The great thing about First Watch is it's a backup system for a lot of things that are happening. And certainly when you talk about terrorism, and Las Vegas being a terrorist target, certainly it's one of those high profile cities that somebody would love to do some damage to. We have some other triggers that are placed in there. One of them is a GI trigger and one of them is a respiratory trigger. So any potential terrorist act that would occur that would potentially be a bioterrorist act where something was put in a buffet, much like it was in Oregon several years ago, or a respiratory issue like what we've seen even from just a normal respiratory event occurring, like an increase in pollen count where there's a lot of respiratory patients going to the hospital, or God forbid it was something more insidious like an anthrax attack or some other airborne terrorist agent that would be dispersed there. We would know that very quickly as those triggers and the standard deviation for the number of respiratory patients or GI patients has been set. So the EMS and the health department, who's also on those triggers, would know before any lab results were done or any surveillance in the hospital, or even the doctors would become suspicious, as everything that was going out in the 911 system would be real-time analysis and real-time notification. So from the standpoint of getting a containment on something that would happen that would be catastrophic like that, or even being aware that's in your system, especially when you're Las Vegas and you have a lot of people coming in and a lot of people going out that could potentially take that with them to other locations. The biosurveillance that we have there is absolutely phenomenal. And again, First Watch is very detailed and again, real-time analysis. It's one of those things that if you're a big community that you would consider in the top cities where there's a potential terrorist threat, it's almost a must-have.